Are you caring and compassionate? Are you ready for the next step in your career? Are you thinking about returning to healthcare? There has never been a more exciting time to join the NHS family. We are recruiting now. We are expanding our services and we have opportunities for you. Look at our brand new 2-storey acute medical unit. You could be working here. Whatever role you choose or speciality you settle on, you'll be trained and developed in a safe, supportive and inclusive environment. We are recruiting now for clinical support workers.
I've been a CSW just over 8 years and I really do enjoy the job. It's the hardest physical job I have ever done, but it is the most rewarding job that I've done. When I started, I had no nursing qualifications at all, no care qualifications. I'd never worked in a care home. I'd retired from the civil service, and once I'd retired, I decided I wanted to do something that I could give something back.
I've worked here for 4 years and it's a great career step if you're looking towards going to do training to be a nurse or a trainee nursing associate, or even going to work in theatre if that's more the kind of thing that you wanted to do.
After all the time that I was actually working in insurance and offices, a friend of mine actually worked as a support worker and told me about the role and what it encompassed and the novice programme. I'd also lost my father, unfortunately, but the care that he received was absolutely amazing from the staff here at Dudley, and prompted me to want to do something and give something back myself.
The best thing is the patient care. They're talking to patients, listening to patients, and when there's patients that's end of life, it's holding their hand but also holding the relative's hand. You can't get that experience back again, so we want to make sure that we get it right for that patient and for that relative.
Recently, in September 2020, I actually started as a trainee nurse associate, which is the next level and the next bridge between a nurse and a support worker.
My typical day on the day surgery would be a busy, fast-paced environment with lots of different patients needing different operations, seeing different surgeons, anaesthetic doctors, relatives, and getting people in and out of the ward safely.
I would really recommend the role of the clinical support worker. It's a lovely job, it's lovely helping patients and people, relatives as well, and I will say this, and I have said it, but it is the most rewarding job I have ever done.
You're always welcome and nothing's too much trouble, and there's no such thing as a silly question, so we've got plenty of support from everyone.
So the Dudley Group is a very friendly trust to work for. It's very supportive, and I would recommend anybody looking to career change or come into this field of career to work for the Dudley Group as a clinical support worker. So if you are trustworthy, caring and empathetic, this will be the job for you.
Our talent is finding yours. We are recruiting now. Come and be a part of something special.